Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and we're here with our two guests today. We have Dr. Ruben Rubenstein, our returning guest, and first-time guest on our show, Dr. Tommy John.
Thanks for having us.
Welcome here, guys. So I'll start off with you, Dr. John. I know you have a very interesting background of how you got into the profession and became a chiropractor yourself. I know you were a professional athlete for a while and have done a lot with sports medicine and personal training. So if you could just kind of go through your story a little with us.
After college, I ended up playing 3 years of professional baseball and retired after that. Got into sports performance conditioning, and then along came rehab. And then prior to getting into our rehab system, a particular system that we specialized in, you had to see a chiropractor. So from my understanding, the results we were seeing were unbelievable for those that would see the chiropractor, to what we would expect and what the outcomes were to those that didn't. So then I became obsessed with what they were doing in the office, the chiropractor, and from my background, it was all just musculoskeletal. So I came down to school, musculoskeletal, torn hamstrings, discs, no problem, this stuff is a piece of cake. Literally, it's a piece of cake. Then I get down to school and find out you can, kids need it, elderly. I mean, it is more than musculoskeletal.
You're missing the biggest component, which is the nervous system.
Absolutely.
The musculoskeletal system surrounds the central nervous system, which is what we deal with mostly as chiropractors. So it's interesting that you saw such different results with people who had seen the chiropractor before the sports medicine rehab than not. And so you kind of just want to get rid of the middleman and
that's the thing. I literally thought with what we had, I'm naive at best, but I had thought I had reached the top of what I could control, so to speak. And I'm like, oh, I've got this. Like, this is wholesome. It's pure. It's based on principles of training, and it's natural. There's nothing added. It's very organic, so to speak. And then I started to see these results come from the chiropractor. I was like, wait a second, what are you doing in there? And then when I would ask the guy, he really couldn't tell me. He's like, I really don't know. And he was more of a kind of randomly adjust this, that, adjust 7 different things at one time, which was still chiropractic. He was addressing the spine, but there were still results. And I wanted to know that. I wanted to have that skill set, master that, and then apply it to this. Now I just found out I can treat kids and parents and everybody else too.
Open up a whole new world, huh? That's awesome. And then tell me a little bit more about, in the professional baseball career, did you have much access then to chiropractors? And
No, that wasn't, it wasn't even on my radar. And to be totally honest, when I ended up getting back to school, during my training and people that would rehab with us, it was I would get questioned by some of my most intimate clients, and they're like, do I really need to see the chiropractor? And at the time, I was just like, I don't think so. I don't think it's that big of a deal. And I've called them since being at school when I found out the power of it, and it was unfortunate that I took that stance, and I influenced them enough, but I had to call and make amends because I was just like, you guys got to get to somebody now because I was dead wrong, and there's power in this. And then I come to find out there's a different way to kind of approach chiropractic. You can't just thumb through the phone book and point and you're
Absolutely.
set, as we know.
And that's the majority of the public in hand. I mean, if you would ask a normal person walking down the street, what do they think chiropractic's for? They think musculoskeletal, they think back pain, neck pain, headaches.
Right.
And it's so much bigger a profession than that. I mean, we're specialists in the nervous system, we're specialists in the spine, we're experts in getting people well from the top down, inside out. I mean, what we do is, I would say, this big of a percentage is back pain, neck pain. I mean, we have people with Parkinson's disease and MS and all these conditions that people think are, they have to deal with in life, and they just get progressively worse. But under chiropractic care, we can actually either stop the progression or actually even bring it back so they're actually starting to thrive and not just survive through life. Right. So, I mean, chiropractic is so much bigger than just those things that, that's what you thought it was, and good thing you got into the profession thinking that's what it was, and then you learned while in school that, wow, this thing you got into is bigger than that.
For sure.
And there again, Dr. Rubenstein, you mentioned some of the neurological disorders like the Parkinson's and multiple sclerosis, and how through chiropractic care we have absolutely amazing results with some of these things, because some of these are demyelination diseases of the central nervous system, where think of like a electrical wire without the rubber sheath on it, and that's kind of what's happening. So if we keep the nervous system healthier, the damage that would happen there can be less severe. We can slow some of the progression of that. And in general, you just mentioned some conditions that are some of the things we help with. And again, most people do think we are just for musculoskeletal or neck pain and back pain. And one of the reasons the chiropractic profession has done a terrible job of marketing exactly what we do to the public. And believe it or not, so many people have neck pain and back pain. It's an easy way to market ourselves, and we've done a good job of portraying that. However, it's a very small percentage of what we do. We deal with the nervous system and the spine as a whole to make sure to keep the spine healthy so that the nervous system stays healthy.
And there is huge opportunity there, like whether it changes in the near future or not, and whether people understand exactly what chiropractic is to what we understand it being and what it was from its foundation, but everybody's in pain. Everybody has something going on with them, and it's always, you got to go see my chiropractor. If they walk through the door and they're in pain, that's fine. Now it's my job to then educate and turn them in my report or my communication and education with them that they're like, man, you know, my son has this and that, or I didn't know it was anything like that. That's fine. Come in the door, come in through my door because of pain, but now it's my job to work my tail off to end up making sure that you know, whether you continue or not, when you go out there, you know what chiropractic is and you can spread the word.
Pain in general is just the tip of the iceberg. A lot of times people will have a problem or misalignment in the spine, interference in the nervous system, without actually knowing it for years before the symptoms actually start to manifest. You know, like with someone's car, you know, there's problems with the engine before the check engine light actually turns on, before it needs to be serviced. It's become that way for a while until it's now enough to actually have the check engine light come on. Symptoms are just like the check engine light. Most people, when they're driving their car and that light comes on, they usually just ignore it and
Put
keep
a
on
sticker
going.
over it.
And it's the same thing with pain or symptoms. Most people have symptoms and they usually just ignore them or take something over the counter until it's bad enough where they finally think about it. Now, when we x-ray that same person or we do an examination, we may find that person has degenerative changes where they have arthritis, they have bone spurs or osteophytic formation in the spine that may have been built up there for years. And so that's why it's important to get your spine checked in general, not just if you're in pain. And like we said, that's barely scratching the surface of what we do. It's the tip of the iceberg. The tip of the iceberg is the symptom. Underneath is the underlying cause. Structure dictates function of the body. Now, with structure dictating function, we get into the fact of performance, like we've been talking about athletes. And now, most professional athletes, whether it's professional baseball, whether it's professional football, hockey, anything, you name it, most of them have a chiropractor on staff with the professional sports team, where they may even be either on the field, or if not, the players go in regularly for chiropractic checkups and chiropractic adjustments to increase overall performance. If the structure of the body is in normal alignment, do they have a better chance of taking a fraction off of their 40 time than if it was misaligned? Absolutely. And so we do a lot with overall performance of the body as well.
Yeah, and most professional athletes, I know Tiger Woods used to travel with his chiropractor. Jerry Rice wouldn't go anywhere without his chiropractor. It's always the superstars always made it clear to the public that they had their chiropractors. Maybe not, I mean, maybe that's what got them to superstardom. Maybe it isn't, but I saw personally the difference between the people like a regular person on a team and the Jerry Rices is he was a huge advocate for chiropractic.
And even within the last 10 years, more and more of the professional sports teams have brought in a chiropractor for daily use. However, 20 years ago, there were still plenty of athletes, and then it was more of superstars that always had their chiropractor rather than just every single player.
Yeah,
now that there is.
exactly.
So we have a video clip we'll play about professional athletics, and we have one specifically about baseball, which you played professionally, and we'll roll that clip in just a second here.
A trip to the chiropractic office is where many athletes find themselves taking care of their bodies in order to maintain maximum athleticism. Aaron has been playing baseball since he was 8 years old. His love of the game has afforded him a full ride to play Division I baseball at Nicholls State University in New Orleans, Louisiana. Aaron believes that his success in sports is due in part to the fact that he supplemented his game with preventative care under the treatment of Dr. Sean McGlure.
A lot of athletes do more preventative care. They want to keep themselves on the top of their game, not just fix themselves after they've become injured.
Okay. You okay? Good. There you go. One more. There you go. Nice.
In order to avoid pain and injury, Aaron receives adjustments on his extremities and his spine. These adjustments increase his range of motion, treat current discomfort, and prevent future mechanic problems which may hinder his performance.
The most common injury or type of injury in young athletes is a musculoskeletal overuse injury. Okay, for example, the articular cartilage is very susceptible to repetitive microtraumas. So in Aaron's case, for example, he's trying to throw the ball more times, faster, have longer periods of pitching versus break time. And when he does this, he creates little microtraumas to the tissues that will extend into his professional career later on in life.
It's important to understand that preventative care is a health partnership.
PT is very important, okay? But what we need to do is make sure that the joints in the elbows, the extremities, the knees, okay, are lined up and everything's working properly. Then we bring PT in to strengthen them in their proper position.
Aaron realizes that his outlook on preventative care has paid off. He now has the opportunity to play professional ball with the Colorado Rockies. One thing is for sure, his commitment to health has done his body good.
So it's interesting to see with a sport like baseball, with like a lot of other sports, let's say golf or bowling, that it's a one-sided sport. So as you're playing the mechanics of baseball, you throw with one arm, you catch with the other, so it makes it easy for someone to have misalignments of their spine, imbalances posturally or structurally.
For sure, and that's something we don't address, and it's not being addressed anymore now, and injuries are getting out of control. Chiropractically, to clear the signal, making sure the signal gets the muscles that needs to do its job, fine. The muscle's job is supposed to absorb force of the body, but baseball, golf, certain racket sports, you end up seeing neurologically the motor patterns that are in these people is so whacked out and twisted, mostly because, fine, you're playing as a kid, that's okay, but you're also, as a professional, then the amount of repetitions that you're doing to prepare for your skill, to practice and craft your skill, it requires so much preparation that nobody's doing the preparation and they're just skill, and then we're having all this breakdown. And it truly lies, you can say at the muscular system, well, what controls the muscular system? Like the signal coming from the brain down the cord out the nerve roots, that's just it. Once that's clear, then it's getting that tissue to absorb the force, so force isn't going into tissue not designed to absorb force, like ligaments, bones, discs, and this is where these injuries are coming
And
from.
everybody knows, with a sport like baseball, everyone sees the injuries in rotator cuffs, or they see the injuries in some of the muscular tissue and the ligaments, but they don't realize how much torque, swinging the bat is going to do on the spine itself, because we have to use our spine to torque the body. Everyone hears about the tears, let's say, for pitchers, and I know this is something you know a lot about, as your father even has the surgery named after him,
Right.
with some torn ligaments, but people don't think about the range of motion in the spine, and so how even getting rid of some of the restriction can increase the range of motion for something like that and improve performance overall.
Yeah, I mean, I didn't play professional baseball like Dr. Tommy did or anything, but I played baseball growing up as a young kid, and I know it wears your body down. I mean, 9 innings of baseball, and you have practice, and you have training, and all this stuff leads to, a worn down body. And thank God I was under chiropractic care always, and I definitely noticed a little edge. I'm not going to say I was the best person in the league, but I definitely noticed that there was some sort of edge, my recovery time for the next game and things like that. I always definitely was able to recover from an injury better, and I think I know that it was because I was under chiropractic care while the other kids were not.
And like I said, the issue can be that professional athletes may have regular chiropractic care on field, part of the medical team. However, the problem didn't start when they were professional athletes. It started from 20 years of playing the sport before that, whether through Pee Wee and junior high and high school and collegiate level. And so these problems can build up little by little. As the bones start to misalign, they start to get used to being in the wrong position for longer and longer and longer with the same motions, with the same things as these people were going through their sport. So the key is not just to have professional athletes increase their performance through regular chiropractic care, but to start with kids. Start with kids that are playing a lot of sports, check their spine. More than anything, check to see what the spine looks like. See if the pelvis is lined up. See if the neck is in the right position. See if the thoracic spine is lined up where it should be. And if it's not, start to work on it right away and work on preventing it. Because it's better to prevent an injury than wait till there is an injury and start to correct it or recover.
I tell mothers all the time that as chiropractors, we care more about preventative care. I'd rather you come in, get your checkup, and get under chiropractic care so you're not crawling into the office later in life. I mean, the best time to start taking care of a problem is when it occurs. So why deal with pain when you're young and let it build and build and build, and then you have those patients that we see it all the time, they're crawling into the office with acute problems. We take a picture of their spine with an x-ray, and then you look at all the degenerative processes that have occurred, and those didn't occur overnight. These occurred from when they were a young age and over.
We're seeing that at younger and younger ages now. I take x-rays all the time on people, and we're seeing people in their early 20s now. We're starting to see some degenerative changes, some minor spurring. A lot of it has to do with some of the posture, some of the things they do on a daily basis, but even playing hard sports. We see a lot of high school football players that are putting a lot of trauma on their body, high school wrestling. I see almost as many injuries from cheerleading and gymnastics as I do from football and hockey and baseball, because this can be very rough on the spine. A lot of forward head motion, which can cause slight whiplashes just from something they just did at practice one day. Don't even think about it. Now 5 years later, they're coming into me, whether they're finished college, they have headaches almost every day that started from when they were a cheerleader in high school 5 years ago. They never would have thought one had anything to do with the other.
And it's crazy. It's multifaceted now. They're starting to talk about why all the arm injuries in baseball and the youth and kids are playing sports. They're specialized. They're playing year-round, this and that. Okay, that could be part of it. You're also having people who are beyond inactive at record numbers. Nobody's doing anything anymore. And then they go and play this sport. So that's their activity. And literally being in a profession where I did baseball lessons with kids, the parents would literally say, this is an activity for the week. We're like 3.5 hours with me. That's his activity for the week for a child. So that's getting worse and worse and worse. Plus now, we know that the body's going to warn us as we're going along. There's going to be warnings, whether it's pain, whether it's itching, a fever, something's going to happen where your body's going to let you know. We're not allowed to feel these things anymore because now, and this is opening up a completely different can of worms, but it's like I'm seeing anti-inflammatories use in kids that are 10 years old in baseball. 10 years old. Well, they're not supposed to feel they're in pain. What are you in pain for? You're 10 years old. What's going on? So now you're not even allowed to feel pain, and then you end up going to where your body was trying to tell you when you were 15, 16, and so now it's one of those things where, okay, trying to prevent that, trying to increase the activity, but what controls the activity? A cleared spine. Also, and this is something that doesn't come into, and we don't equate this to chiropractic care, and I'm trying, and I've made connections with high-level guys just in the short time I've been in practice now. Chiropractic is in control of the CNN, the central nervous system is in control of the immune system. The immune system is directly involved with your recovery from sport. A sport is not an activity you play to heal. It is not an activity you play from a therapeutic. It is an absolute competitive breakdown. You need to do things to come back from your sport. Your sport's going to break you down. What heals you from anything? Your immune system. What governs that? Your central nervous system. Who's a profession that has the guidance over that? Chiropractic.
Absolutely. And I like the way you said that a sport is not something that's therapeutic, the sport breaks you down, because a lot of people even think, running or things like that, which are great for, cardiovascular. However, it is wearing on the joints. Someone who runs 24 miles, someone's running 10 miles, 15, 20 miles, that's a lot of wear and tear on the joints, on the structure, on the frame. Whether it's good for the cardiovascular system or not, that's fantastic for the body. However, it's still wear and tear. It's not therapeutic for that part. So it's important for people that do some sports that they wouldn't necessarily think are hard on the body. Like I take care of a lot of professional bowlers, professional golfers. Again, that's the same kind of thing, one-sided sport, just like baseball. You're swinging the same motion, one side all the time. Tennis is the same way. And that can cause all sorts of structural problems down the road that people are thinking that they're just getting a workout. And they go play tennis for 3 hours every day, and it's just good for them. It is good to have cardiovascular workout, absolutely. However, again, the structure may not be maintained throughout it.
Yeah, exercises, we're not saying that exercise is bad and to not do these things. We're saying to listen to your body. If your body's telling you, hey, you're in pain, take a day off. And the thing with exercise in general is if you're exercising with a misaligned spine, those muscles are attached to the bones of your spine. And the bones of your spine, if they're out of place, those muscles are always going to be tight. The neurological signals from your brain to those muscles are not going to be in full force because the signals are being pinched off by the nerves. So, yes, you are working out and you're getting great cardiovascular, but you may be actually doing more damage and degeneration to your spine by not having a clear spine while you're doing those exercises.
Well, like the car that's out of alignment, the tires start to ball, the parts start to wear out. If you go get the alignment checked right away, great. If you don't, the more you drive on it, the faster it then wears out. And so exercise, again, was one of the most very important things someone can do for their overall health. That's one thing we want to make sure we're clear with. Exercise is very, very important. It's one of the most important things someone can ever do for their health. However, if you're doing strenuous exercise on and over misalignments, it can cause spinal joints and the nervous system to wear out faster than normal. And like we were saying too, kids that aren't warming up, they're not doing anything, just a couple hours a week, they're going and having a strenuous activity. It's not just the kids, it's not just professional athletes, it's the weekend warriors. This last weekend I was at the fair and they had the throw as fast as you can thing. And people are just walking up, haven't thrown a baseball in years, and they just wrench their body as hard as they can, causing all sorts of different problems. And it's the dad who's throwing the football around, hasn't thrown a football around in 20 years and starts playing with the kids, trying to keep up with his high school son. So we see a lot of injuries from things like that as well.
Yeah, I mean, I was at that fair and I knew, okay, don't pick up this baseball and try to throw it 70 miles per hour to win a stuffed animal, because what it's going to do to my arm is going to be way worse. I can go to a store and buy a $5 stuffed animal. I mean, it's completely correct. I mean, people, okay, let's pay money to just throw your arm out. Man, no thanks.
Not a good investment.
Yeah, not a good investment.
So let's talk, we talked about a lot of the repetitive injuries from some sports, but now we'll talk a little bit about, like you mentioned, Jerry Rice, football, hockey. Some of these can be collisions where we actually have whiplash on a given play. Almost any given play can really throw the neck out of place, whip the head forward, cause soft tissue damage. And so we actually have a clip of Jerry Rice and his endorsement for some of the care that he's had throughout his career. So we'll go ahead and we'll roll that clip and see what Jerry Rice has to say.
Hello, I'm Jerry Rice, and I am pleased to be talking to you about my experiences and the value of chiropractic care. I believe in chiropractic, and I know that it works. You probably know about my long and successful career in football. I'm flattered by the testimonials to my durability. Football is a very rough and vigorous sport. Many of the pass patterns in a game, either long or short, required a maximum effort. I took some vicious hits from players nearly twice my size. Thankfully, I had the durability to withstand these tackles, or I would have never succeeded or lasted as long as I did. Chiropractic was the key to keeping me in the game. My first experience with chiropractic care was right before the 49ers were to play the Bengals in Super Bowl 23. A couple of our players were injured and a chiropractor turned things around. I quickly became a believer, and ever since I have had the benefit of chiropractic care. Dancing with the Stars was every bit as exhausting and challenging, though not nearly as brutal as football. It required many hours of practice. I had aches and pains that I never had before. Again, chiropractic made the difference and kept me dancing and in the competition. The game of life requires the edge that chiropractic provides. Chiropractic care helps me to lead a very active lifestyle. I have seen its value both personally and professionally among my friends and teammates. But most people aren't aware of the benefit of chiropractic. That is why I support the efforts of the Foundation for Chiropractic Progress. They promote chiropractic through consumer education outreach.
So with something like football, even with the helmets, even with the shoulder pads, when someone comes like this and hits the shoulder, there's a lot of axial compression, a lot of movement from the head from side to side. Remember, our heads are like a bowling ball on a stick. We have a heavy head, we have a small neck. Big head, small neck. So imagine if this model was 100 pounds. For our studio out there, you can see that if I was to hold it out here, it would feel a lot heavier than if I held it in here. So as the head's going out, when you take an impact or a collision, it can take the weight of the head, run it forward, multiply it by 3 to 4 times, place it right through here. So we do see a lot of neck injuries, and not just neck injuries directly, but wear and tear on the neck from sports like wrestling, from sports like football, from sports like hockey, where now, especially if the spine starts to stay like this, and a lot of times people won't get their spine checked for years and years. They'll just keep playing through it, and now we have some soft tissue damage or injury in the ligaments that may surround the front of the spine from this old whiplash. And now scar tissue on a weekly basis starts to build up around the joints. Adhesion starts to build up around the joints. So we start to see decrease in range of motion. A lot of times as athletes, that's when they first start to notice a problem, as they notice they just can't turn their head quite as far as they used to. And so then we can take an x-ray. We see where there may be degenerative changes. And what that means is the disc space, or the cartilaginous, mostly made of fluid and water, but cartilaginous plate in between of the vertebrae can start to lose space. When that starts to lose space, we start to see the body build up calcium deposits around the edges of the disc. And when that happens, what we call it, that is bone spring. Osteophytic degeneration is our technical term, but the term that most of our studio audience has probably heard is bone spurs. And so now with athletes, and I've seen some retired football players that come into our office, we take an x-ray on them, 48 years old, they have the spine of a 75-year-old because of so much damage and wear and tear. And that's why, again, I would love to take care of the retired football players. However, if we caught them before their career even started, kept healthy alignment throughout their career, they may have prevented a significant amount of degeneration and pain and suffering down the road.
Yeah, and this you see more and more in the news these days of retired football players, and not only are they having these degenerative changes you're talking about, but they actually having neurological deficits. I mean, these people are disabled. They're actually the lawsuits against the NFL that they're trying to get protection for the players because
Concussions, brain function.
exactly all these concussions these people get. I mean, back in the day, you had a concussion. All right, get back out there. Now there's
fingers, two, go.
Now there's a whole routine that a player has to go through to even be able to play the next game, which is great for the players and great for their overall health. I mean, these people, these concussions are putting huge damage into these people's spine, into their brains and all these things. And later in life, I mean, you're having crazy symptoms that could be occurring because the bones were out of place, putting the pressure on those nerves that we were talking about earlier. If the pressure's on the nerves, the signals aren't getting to where they're supposed to be properly. So definitely it's smart for everyone, from a child to an adult, to be under chiropractic care.
We actually see a lot of, not just kids, but adults as well, with post-concussion symptoms, right? And so a lot of times they may have dizziness, blurred vision, things like that. Some of the, and migraines, headaches, some of these may last months and months or even years. I've had people coming in that had post-concussion symptoms that have lasted for years. And by working with, especially the upper cervical spine, where the brainstem comes down through the very top bone in the spine called the atlas, we can have some great results with people alleviating their symptoms, of course, but also just increasing overall function in that. And it's not just football and hockey. People have concussions from all sorts of different things. They slipped and fell on the ice. They had a car accident and they hit their head on the side. All sorts of different things can cause some of that same whiplash or concussion symptoms.
Yeah, but we just got to make sure we get, I mean, like I said earlier, the best time to take care of a problem is when it occurs. We don't want time to lapse. We want you to, I mean, we're talking about even an auto accident. You got someone that comes in after an auto accident, it's the same problems, but these athletes, this is happening to them every single day, these repetitive macro traumas that they're just getting slammed into the wall in hockey, slammed into the floor. I mean, a running back, his whole job is running into those people in front of him.
Yeah.
And the other people's job is tackle him to the ground. I mean, that's every single play. These guys are just getting tackled and their spine is taking the blunt force of the trauma. So
I like how you said that, the first phrase there. You said, best time to take care of the problem is when the problem starts. Again, to our audience, that doesn't mean when the symptoms start. That means when the problem occurs. There's a big difference between when the symptoms occur and when the problem or the misalignment first started.
Right.
And so we just have a minute. If there's any one thing you want to share with our audience before we wrap up.
Get to a chiropractor as soon as you can. You have no idea what's lying underneath the skin, what's going on with your spine. These guys are trained to detect things that are silent, and they're called subluxations, and it's interference between your brain and the rest of your body.
Thank you, Dr. John, for joining us. Thank you, Dr. Rubenstein.
thank you for having us.
Thank you for joining us. This has been Ask the Chiropractor. I'm Dr. Adam Rodnick out of Commerce Township. And remember that God gave you the gift of life, and what you do with that life is your gift back to God. We'll see you next time on Ask the Chiropractor.